Good day, ma'am. I am Angelika Bernal from BSN 1C Group 2. So today I am going to demonstrate the proper procedure of assessing the peripheral vascular system. Hello, sir. I am Angelika Bernal, your student nurse for today, and I am from CSPC. So, sir, may I verify what is your full name?
Aris December,
And your birth date po?
October 31, 2000.
Okay. So, sir, before we start, I have performed hand hygiene and then gather all the equipments that I will be using in assessing the peripheral vascular system. And also, I have provided a privacy for the client. So, sir, before we proceed, sir, sa physical assessment, may mga katanungan lang po ako sa iyo. So, sir, do you experience skin changes of color in your skin?
No.
So, do you experience leg pain, heaviness po, or does it awaken you at night? So, do you have a previous problems with circulation in arms and legs? So, sa family history naman po, may history po ba kayo ng varicose veins, diabetes, or hypertension sa family niyo po?
No.
So, do you use medication to improve circulation or control your blood pressure?
No.
Okay, so I have gathered the subjective data from the client. So, sir, rest assured po na we will keep this within the confidentiality. So, sir, sa procedure po na ito, kailangan ko po yung cooperation mo. So, okay lang po ba yun, sir, sa'yo if itatouch ko po yung certain body parts niyo po? Okay. So, the first physical assessment that we will be assessing is the arms. So, sir, we need to inspect bilaterally for size and the presence of edema and venous patterning. So, upon inspection, the arms are bilaterally symmetric and minimal variation in size and shape. So, there is no edema or prominent venous patterning observed. So, next po is we will be inspecting the skin color. So, we should always note that the color varies depending on the skin tone of the client, but upon the inspection, we observed that the color of the skin ni patient is bilaterally equal po and or bilaterally same. So, next po is we need to inspect the fingertips for clubbing. So, upon inspecting, there is no clubbing observed. And then next is we are going to palpate the hands of the client in order to assess for the temperature using my dorsal fingertips. Kabila naman po. So, upon palpating, using my fingertips on my dorsal surface of the hand, the skin is warm to touch bilaterally from fingertips to upper arm. So, next po is we are going to determine the capillary refill. So, upon doing the capillary refill, the color should return less than 2 seconds. Kasi if if lagpas na po siya sa 2 seconds, it may indicate vasoconstriction and then decreased cardiac output, and also the shock, arterial occlusion or hyperthermia. So, upon palpating, upon determining the capillary refill, it is normally returning on its color, which is pinkish. So, next is we need to palpate for the radial, ulnar, and brachial pulses. And then, sa radial naman po, so we are palpating for the brachial pulse, and then we are going to palpate the ulnar pulse. So sa kabila naman po, we are palpating the radial pulse, the ulnar, and then the brachial. So it is bilaterally strong, and next is we need to palpate the epitrochlear lymph node. Epitrochlear lymph nodes behind the elbow, and then in the groove between the biceps and triceps muscle. So here, as you can see po. So normally po, the epitrochlear lymph nodes are not palpable. So if enlarged po yung epitrochlear lymph node, it may indicate infection in the arm or the forearm. So next po ma'am, next procedure po is we are going to perform the Allen test. So by occluding the radial and ulnar arteries and observing the palm for pallor, then release the ulnar artery and watch for color to return the hand. So sir, ipapalpate ko po ito, and then i-close mo po yung kamay mo. Close mo po. Ganito. Then, release po, sir. Okay. Close po ulit. And then, release. Okay. So, the pink coloration returns to the palms within 3 to 5 seconds, and the ulnar artery is patent. Pink coloration returns 3 to 5 seconds if the radial artery is patent. So, the next procedure po is we are going to do the physical assessment on the legs of the patient. So, we need to maintain and provide privacy for the client. So, we are going to ask the client to do the supine position. So, sir, higa ka po dito, sir, sa bed. Higa ka na po, sir. Ito ka na po, sir. Higa. So, the client is in a supine position now. So, first is we need to inspect the bilaterally. We need to inspect the legs bilaterally, and then we need to inspect for its skin color. So the skin color of the patient is pink. It is pink color for lighter skin. Okay, so next is we are going to inspect for the distribution of the hair on the legs. So it is bilaterally equal. So the hair covers the skin on the legs and appears on the dorsal surface of the toes. So next is we are going to inspect for lesions or ulcers. So upon inspecting for lesions or ulcers, there is no lesions or ulcers observed. So next is we are going to palpate the superficial inguinal lymph node. Superficial inguinal lymph nodes while keeping the genital drape. If we detected, we should note the size, mobility, or tenderness on the inguinal lymph node. By using my fingertips, sir, I am going to raise this. So, ma'am, assuming that I am going to palpate here, and then I feel the inguinal lymph node, and then next is I am going to palpate and auscultate. So as I have palpated here, I feel na-feel ko po yung inguinal lymph node. So i-auscultate ko po yun over para po marinig if may bruits. Okay, so upon palpating the superficial inguinal lymph node po, ma'am, the inguinal lymph nodes, while keeping the genital drape, it is non-tender and movable lymph movable lymph nodes or up to 1 or even 2 cm are commonly palpated, and then upon palpation and auscultation naman po, ma'am, it is strong and equal bilaterally. So next po, ma'am, is we are going to palpate for the popliteal pulse. So sir, here, we should palpate it here. So it is not usual for the popliteal pulse to be difficult or impossible to detect. Yet for circulations, it is normal. So next is we are going to palpate for the pedis pulse. Here naman po yun, ma'am. Next is we are going to palpate for the posterior tibial pulse. Here po. So I can feel the posterior tibial pulse and also the popliteal pulse, and then the dorsalis pedis. So next po is inspect varicosities and rhombophlebitis by asking the client to stand. So sir, tatayo ka po, sir. So we should remove this po. Okay. So sir, tayo ka na po, sir. Tayo ka po, sir. So, like that. By asking the client to stand, we should assess that. So, upon inspection po, veins are flat. Upon inspection po, veins are flat and then there is no visible varicose. So, normal naman po. So, next is we are going to ask the client to do again the supine position. So, sir, higa ka po ulit. And then, we need to provide some privacy for the client. So here we are going to assess the arterial or venous insufficiency by eliciting bilaterally for Human's sign. Okay, Human's sign. So here we are going to raise this and then. Okay, so there is no veins palpated. And then next is we need to observe so okay naman po. And then next is we are going to kapag present po yung varicose, we should perform the manual compression test by having the client stand. And then we should firmly compress the lower portion of the varicose vein with one hand. And then by placing our hand 6 to 8 inches above head, and we are going to feel the pulsation in the upper hand. So, since wala naman po na feel and wala naman po na-palpate na varicose veins sa patient, assuming that we have performed that assessment. So next is we have to perform if we need to know if the varicosities are present, and then we are going to perform the Cantel-Birch test with the client in supine position. So, ma'am, so that's all for today, ma'am. And then after that, I have assessed the patient. I need to formulate a collaborative problems and then make necessary referrals, and then create a nursing diagnosis and refer it to the attending physician if necessary. So, sir, in overall assessment po in your peripheral vascular system, it is all normal naman po, and there is no problems. There is no problems assessed upon I have assessed you, sir. So the data that I have gathered will be kept within confidentiality. So, sir, you can change your clothes now, and then thank you for your cooperation, sir. Okay, sir. So that's all for today, ma'am. Thank you po, and have a great day.